Did you know that millions of people all over the world use eye drops regularly, and many people find it difficult to administer eye drops properly? If you or someone you love are one of the millions of people that have trouble putting their eye drops, this is the video for you, because I'm going to teach you in 5 minutes everything you need to know to become an expert in putting eye drops. Hi, I'm Dr. Audrey Tai, a board-certified and fellowship-trained refractive and cataract surgeon, an ophthalmologist, and cornea specialist. And today, I'm here to help you master the proper technique when using eye drops. Using eye drops can be daunting for many people, particularly when doing it on your own. Whether you're using prescription eye drops from your eye specialist or surgeon, or over-the-counter preservative-free artificial tears. By the end of this video, you'll be a pro at administering eye drops safely and seamlessly. Let's jump right into the tips. Number 1, make sure the area is clean and wash your hands. Always make sure to wash your hands thoroughly. Your eyes are sensitive tissues and you do not want to get an infection. After you have washed your hands thoroughly, place the eye drop cap on a clean towel or tissue and make sure to avoid touching your eyes with the dropper tip. A pristine environment is essential for the safety and effectiveness of your eye drops. Number 2, refrigerate your eye drops. Refrigerating your eye drops can be a game changer for some people. If you have sensitive eyes or suffer from dry eyes or use eye drops that sometimes burn, the cooling sensation of the chilled drops can be a refreshing change from your previous experience. In addition, cooling the eye drops will make it so that you can feel the cold drop going into your eye, so you will always know it got in or not. Number 3, check the expiration date and shake the bottle to mix. Always check to see if your eye drops are expired and never use expired eye drops unless your doctor tells you it is okay. Expired drops may not be as strong as they were originally, and they may also be contaminated with bacteria if not stored properly. After checking the expiration date, shake the bottle for about 10 seconds or more to make sure that the drops are well mixed. Number 4, another important tip is to use a two-handed technique. I recommend that you use your dominant hand to hold the dropper bottle. This will let you squeeze hard enough to get the drop out and also control where it lands. Use the fingertip of your other non-dominant hand to hold down your lower eyelid. Some people like to rest their dominant hand on their non-dominant hand when applying eye drops. This is good if you need extra stability. Now lift your chin with your dominant hand holding the eyedropper, and you are going to place a single drop in the eye. Which brings me to tip number 5. Less is more when it comes to eye drops, so only putting one at a time. The average eye can only hold around 10 microliters of fluid at a time, while the standard eye drop size is 50 microliters. That's 5 times of the amount that an eye can actually hold at one time. So overloading your eyes with multiple drops not only wastes the medication, but may also increase the likelihood of unwanted side effects. Number 6, after you have placed the drop in your eye, keep your eyelids closed for about 30 seconds, and using your fingers, gently place pressure on the inner corner of your eyelids next to your nose. You'll feel little bumps there, which are drainage canals called puncta, which drains tears and the eye drops into the nose and bloodstream. Gently occlude these drainage canals, more of your eye drops will be absorbed by your eyes, and less will be draining to your nose and bloodstream. This is especially important for medications that affect the whole body, such as steroid eye drops or certain glaucoma medications. Gently blocking the puncta will reduce the risk of unwanted systemic side effects. Number 7, if you use multiple eye drops, only place one eye drop in the eye at a time, and always wait 5 to 10 minutes in between eye drops unless instructed otherwise by your eye doctor. If you use more than one at a time, the first drops will just get washed out by the later ones. Number 8, supine simplicity. For those of you who are still having trouble with the technique described above, you can try putting your eye drops in while leaning back in a chair or even laying down. If you're still having trouble, whether looking up or laying back, you still just can't seem to get the drop in the eye consistently, try laying back and closing your eye and place a drop or even 2 drops in the corner of your closed eye. Then open your eye, blink once or twice, and then hold your eyelids closed as described above. This method combines several of the tips and techniques that we have discussed today, and is particularly effective if you need to put eye drops in a small child or someone who has difficulty cooperating with eye drops, or if you yourself are still having difficulty. This method is particularly suitable for individuals, including children, who may feel uneasy about direct eye contact during the application. The In the Corner approach offers a more comfortable and less intimidating experience. By tailoring these techniques to your comfort and situation, you can master the art of applying eye drops with ease. I hope you have found these tips and techniques helpful on your eye health journey. If you have learned something new, please consider hitting the like button and subscribing to my channel to support more informative content on eye health and surgery. You can also follow me on Instagram, Facebook, and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you for watching, and I will see you in my next video.